Here is the must-have plan if you're going to enroll in a Medicare Advantage plan. What's up, friends? Rob here. Some know me as the Medicare Minister with Agape Insurance and Financial Group in Tupelo, Mississippi. And today I'm going to be talking to you about a must-have plan if you're going to get enrolled or sign up for a Medicare Advantage plan, also known as a Part C plan. So what is this one plan that you have to have? Well, I call it a GAP plan or a hospital reimbursement plan, but the official name of it is called a Hospital Indemnity Plan. And while there are various hospital indemnity plans out there, you definitely want to make sure that you get signed up for the right one because it does make a difference. Before I dive into that and why you need one, let me talk a little bit about a Medicare Advantage plan. Number one is in most cases, they are zero premium plans. Number two, the Medicare Advantage plan takes your medical, your prescription drugs, and all these other benefits like dental, vision, hearing, and over-the-counter card, gym membership, and more, and puts it into one. So what is it, a Medicare Advantage plan? You can get Medicare benefits through Original Medicare, and maybe some of you are on Original Medicare with a supplement and a separate drug plan, or a Medicare Advantage plan, like an HMO or PPO. Stay tuned, because I'm going to talk about the differences between an HMO and PPO here in just a second. If you have Original Medicare, the government pays for Medicare benefits when you get them. Medicare Advantage plans, sometimes called Part C or MA plans, are offered by private companies approved by Medicare, and Medicare pays these companies to cover your Medicare benefits. So short version, you have two options: Original Medicare, red, white, blue. I get a Medigap, or also known as a Medicare Supplement Plan. I get a prescription drug plan, and then I get any other ancillary plan that I may need to shield myself or to cover those expenses that your Original Medicare doesn't cover. Or option two is a Medicare Advantage plan that Medicare basically outsources all of your medical coverage or benefits to that particular company. Aetna, United Healthcare, and Humana are some of the top three that I can think of right off the top of my head. So a Medicare Advantage plan can be a great program for you if you understand all the dynamics and the nuances involved in a Medicare Advantage plan. So I want to be very, very clear here. A Medicare Advantage plan, otherwise known as a Part C, is not a supplement. Unfortunately, you hear many people talking about it being a supplement, especially these scammers on the phone, these call centers that are targeting vulnerable seniors and telling them they're on a supplement and that they qualify for a zero premium supplement. That is not the case at all. So you definitely want to make sure that you know what you're getting into. And I always recommend this in every video, and that is if you want somebody you can trust and someone that will explain everything to you and make sure you understand both sides of the plans, then give us a call. The number's on the screen. Either myself or one of our seasoned advisors would be more than happy to help you. No cost or no obligation to you. Okay, so what's the difference between an HMO and a PPO? Gonna sign up for a Medicare Advantage plan, I would always sign up with a PPO and not an HMO. And the main reason is, if I could just put it in very simplistic terms, an HMO is very restrictive and mandates that you go in the network unless it's deemed a medical emergency, okay? Where a PPO will allow you to go in and out of the network. However, you will pay a little bit higher cost if you go out of the network. So if a PPO is available in your area, in many cases, you're going to lose some benefits than what you would get with the HMO, but I promise you it's worth having a PPO and that peace of mind to be able to go where you want to go and not have to pay the full price, okay? Because most of the time when you go, probably not going to be a medical emergency, which means the HMO is not going to work for you. So before I talk about this hospital reimbursement plan and why it's a must-have plan and break down to you the need for it, if you're getting value out of this video so far, please take a moment to like, comment, subscribe. This just helps us get in front of more Medicare beneficiaries like yourself and allows us to help them. All right, so let's get back into this hospital reimbursement plan, otherwise known as a hospital indemnity plan. With your Part C or Medicare Advantage plan, there is copays built in to the plan. So let me give you an example of one of the copays that you really want to be shielded from. That is your inpatient hospital stay. Because in most of these plans, they're going to make you responsible for the first 7 days in the hospital, generally between about $250 to $300 per day. Now, the good news is the average hospital stay across the country is about 3.5 days. And so you definitely want to have a reimbursement plan in place to help shield you against that. Once again, you want to get with a seasoned advisor that knows how to structure these properly, so that way that you are protected. Another copay is outpatient surgery copay. When you look in the fine print of these Medicare Advantage plans, you are responsible for a copay starting around $200 and going up, depending on which region of the country you live in. And so you can design these hospital reimbursement plans to help shield you against that copay as well. Copay number 3 is ER visit copay. Most of these ER visit copays are going to be between $50 to $100 depending on where you live. Well, if that's the case, then which it is, you can structure these hospital indemnity plans to shield you against that copay. And then finally, ambulance ride copays. These copays are generally $200 and up. That's your responsibility if you're on a Medicare Advantage plan, and you can structure a hospital reimbursement plan, or what I call a gap plan, to shield you against that copay as well. So that's 1, 2, 3, 4 copays that you need to be aware of, that when you're thinking about signing up for a Medicare Advantage plan or Part C plan, you want to make sure that you're aware of these copays and how much they are. And then I strongly recommend, it's a must-have, I believe, that you should have a hospital indemnity plan in place. And here's the best news of it all. Most of these plans, if structured properly, are going to run. Now, once again, that's going to depend exactly, which part of the country you live in. Here in North Mississippi, most of those plans run between $55 to $65 per month. So your Medicare Advantage plan in most cases is $0. And then you add that $55 to $65. For $65, let's just use a high-end figure, you can have really good coverage that fits in your budget and shields you against a lot of those healthcare expenses out there. So if you would like to talk to us about it, we would be more than happy to do that at no cost and no obligation to you. You can simply call the number on the screen or reach out to us through our website, and we would be more than happy to talk with you and make sure that you understand fully what you're getting into. Well, guys, I hope you enjoyed this video. Have a great day, and we will see you on the next video.